I have a team of financial advocates, about 40 people that work hand in hand with the uninsured to get them qualified for Medicaid and other forms of financial assistance. And on average, if you walk in the door as an uninsured patient, about 50% of the time we're going to get you qualified for Medicaid. That's good for the patient because now they have coverage and they have access to care that they didn't have before, and it's good for the organization because we're going to get paid for the services that we provided. Second, now with the implementation of the Affordable Care Act, I think you can say the same thing with respect to open enrollment. It really allows an opportunity for those people that, from an economic standpoint, don't have access to group health through their employer or through some type of individual plan because of the cost, but they make too much money to qualify for Medicaid. It's really that working poor population, and we've seen improvements over the last 16 months since the Affordable Care Act and open enrollment began, where there's been a shift out of the uninsured population up into our commercial population. So one of our biggest priorities and really one of our biggest changes going forward is the recognition that a one-size-fits-all approach to our patients is not the best approach for them and for us. About half of our population is Medicare, about a third of our population is commercial, and about 20%, 25% of our population is Medicaid and the uninsured. Each of those populations has different clinical needs, and each of those populations has different financial needs. And so as we go forward, we're trying to be much more flexible in our options than we have been in the past. Historically, kind of the mantra was, you need to pay, and that was the end of the conversation. Going forward, the conversation is much more about sitting down with the patient, having an educated, intelligent, engaging conversation with the patient and really understanding the needs of the patient. One of the biggest areas where we've seen growth over the last 3 years is actually in our payment plans. We partner with an organization called Clear Balance, and even though we're seeing growth in out-of-pocket responsibilities, and even though we're only collecting a small percentage of that, when we look at our other payment options in terms of our internal efforts or early out, or unfortunately in those cases where it warrants, our bad debt options, the one area where we've seen improvements and increases in our patient payments is in that patient plan option with Clear Balance. And again, I think that's because for a lot of patients, having access to flexible, affordable payment options above and beyond pay in full is really the new wave of consumerism and really something healthcare organizations need to focus on in the future. Over time, we've implemented disparate IT and billing systems. All of those systems were implemented for good reasons. However, in the situation we're in today, just from a revenue cycle standpoint, we have 5 different billing systems. We have a homegrown system for the hospital. We use MISIS for our physician enterprise. We use NextGen for our urgent care. We use Epic for our residency and some other service lines. And then we've got a couple areas where we actually outsource our billing to one of our strategic partners. That doesn't lend itself to a simplified billing process. So about 1.5 years ago, we executed a strategic agreement, strategic partnership with Cerner in Kansas City. And one of the things we're doing over the next 18 to 24 months is moving all of our revenue cycle systems, both in the acute space as well as in the ambulatory space, to Cerner's full suite of revenue cycle solutions. We believe once we have everything on Cerner and we really have one enterprise IT system across the organization, both from a financial as well as a clinical standpoint, that will afford us opportunities that we don't have today in terms of our ability to engage with the patient as well as simplify the process for the patient and for ourselves.